A dog that has an established diagnosis of osteoarthritis has been prescribed gabapentin for pain. And the question is, should it be given as needed when the dog is demonstrating signs of pain, or is a daily maintenance dose to stay one step ahead of the pain recommended? What's typically advised in the rationale?
Yeah, exactly that. It has to already be there waiting. So the way that I explain out to people is that you have these pain pathways that are getting sent through the spinal cord, and the gabapentin stays there and waves its hand and stops it from coming through. And so the pain signals are already coming through. The gabapentin can't chase after it. It has to already be present at the receptors. And so for some dogs too, and cats, depending on the degree of pain they have, they might need a different frequency or different dosing. And so I think oftentimes I'll have clients that either use it as needed or they give it once a day. And for gabapentin, that's just not going to be enough, for most animals. So for that reason, pregabalin is nice because you can give it less frequently for a lot of them. But definitely I use it as a chronic daily medicine. I don't know how you guys feel, but.
I'm the same. I use it. If I'm going to put a pet on it, I want it to be there. And so, an NSAID I'm happy to use more on an as needed basis or taper down to a lowest effective dose. But gabapentin I tend to do in a more, will stay at this dose range.
One last question. Is pregabalin as effective as gabapentin? And is there any difference in the drowsiness it causes?
Sure. Yeah. I definitely think it can be as effective. I think every dog's a little bit different how they respond. So I think anecdotally, I've had some dogs that have had not even necessary sedation, but just behavior change, like aggression with pregabalin that they haven't had with gabapentin. And so what I'll usually do is just kind of determine what's going to work best for the owner convenience wise, because oftentimes just the lower frequency of dosing for pregabalin makes it easier for people to do. And so some people have already been on gabapentin. So if they're already on it and it's working for them, I'm hesitant to switch them over. But yeah, I don't know other people's experience with pre-gab, but I use it a lot for seizures as well. And so the dose that I use for seizures is a little bit higher than I would use for pain. And so some of those side effects I see more with the seizure patients too. Sometimes they have both, and I love it because I'm like, great, you can have it for your epilepsy and for your LS disease. So
There you go.